Welcome to Adapt NCLEX. Do you want to know if you're ready for the NCLEX? NCLEX practice question, 85 question on high-yield topic that shows up on your NCLEX. This you need to watch, pause the video, answer the question on your own, keep track of your record, and at the end, I want you to put your score at the end in the comment section. Are you ready? Let's go. First question, as usual, test-taking strategy, read the question from the back, go for the buzzword, and use it to answer the question. Which finding the nurse should be most concerned about? A nurse care for a client on amiodarone therapy for atrial fibrillation. Cardiology is key, and this is pharmacology. New onset cold intolerance, new onset warm intolerance, new onset dry cough, new onset tinnitus. Which finding the nurse should be most concerned about? Pause the video, answer the question on your own, but this is testing your concept. What do you think? I can tell you the right answer is what? New onset cough, because the most major side effect of amiodarone is pulmonary fibrosis. You're going to get hypothyroidism, expected finding. This and that associated with hypothyroidism and hyperthyroidism. Hearing problem is not a problem. Major complication with amiodarone is what? Pulmonary fibrosis. When you see any questions on amiodarone, remember pulmonary fibrosis. That's what the NCLEX is going to test you for, and therefore that is the right answer. Number one is done. Next question. A 50-year-old client presented to the emergency department with serum sodium of what? 124 milliequivalent per deciliter. Which action should the nurse prioritize? Your keyword is sodium 124. Put it together, ask yourself, if you see a patient with the sodium 124, what would you do? Don't overemphasize. Don't go around chasing everything. Keyword 124, prioritization. Administer 0.99 normal saline as prescribed. Give the patient 3% normal saline as prescribed. Initiate seizure precaution. Administer bumetanide as prescribed. What do you think? Once again, pause your video, answer the question on your own. You pick your answer? I can tell you the right answer is safety. Initiate seizure precaution because this patient is going to go into seizure. Of course, you're going to give them what? Normal saline is done enough. This patient will need 3% normal saline. 0.99% normal saline is not enough. This is okay, but by the time you get it ready, you don't need an order to do that. Initiate seizure precaution, easy thing, more safety than giving them prescription. Bumetanide is going to worsen the hyponatremia, and therefore, in this case, C is our right answer. A nurse is in a pediatric unit is caring for 4 clients. Which client should the nurse prioritize? The same thing. What is that? Be sharp. Who is going to be in trouble? Who you don't have time with? Not because of the diagnosis, but overall. 7-year-old, I'm going to point to you when you're reading it, this is the way you should do it. 7-year-old with meningitis and dark purple rash. Do you expect that in that patient? 7-year-old with the varicella is crusted vascular lesion. 7-year-old influenza with the temperature 101, and then patient has fatigue. A 1-year-old with RSV who has what? Large voluminous nasal discharge and a temperature of that. They all have a problem. They all need some care. They all need your help. But who is in trouble? Who you don't have time? That's how you do prioritization. Don't just look at the words. Who is in trouble? And you have to be sharp. If you need more about be sharp, check Adapt NCLEX on prioritization. It will tell you how to go through systematically. But for this question, who do you think we need to see? Think about it. This patient has meningitis with dark purple rash. Meningitis, fine, but with the dark purple rash, that means we have sepsis. But this is meningitis associated with sepsis. Therefore, this patient is in trouble. Varicella with the crusted lesion, you don't need to do anything anymore. Influenza, you're going to have some temperature. If you have RSV, you're going to have large voluminous nasal discharge. It's suspected finding. Therefore, 1 is the right answer. And this is assessing a client with peripheral venous disease. Which of the following are consistent with PVD? Select or apply. You have to know the difference between PAD and a PVD. That means chronic venous disease. brownish discoloration of the skin on the leg, ulcer on the medial aspect of the ankle, cool skin with what? Poor hair growth, pitting edema in the lower extremities, +1 pulses or absent pulses, pain that is relieved by elevating the leg, history of prolonged standing and varicose vein. You have to know the difference between arterial disease and a venous disease. There's one word now you can use to answer the question. You pick your answer. These are select or apply. You don't have to over-select. Pick those you are 100% confident so that you don't lose point. But based on your buzzword, chronic venous disease, I can tell you the right answer is what? Based on chronic venous disease, the major problem is what? It's due to what? Too much blood flow. Therefore, anything that has less blood flow, I'm not picking it. Browning discoloration of the skin. There's too much blood flow. The blood go there and it turns the skin brown. Also on the medial aspect of the ankle. Yeah, if it's at the toe, that will be a peripheral arterial disease. The extremities is going to get warm. It's not going to get cold. There's going to be edema because there's too much blood going there. Your pulses will be bounding. It's not going to be weak. When you elevate your leg, you take the blood out, and therefore the pain is relieved. And then when you stand for a long time, blood goes to your leg, and this causes varicose vein. This is the way you should understand PAD and PVD. Just one word, like I told you, blood flow. Don't worry about so many information that distract you. Blood flow. You can use it to answer any question on a PAD or PVD. And this is educating a new graduate about early signs of pregnancy. Which of the following is a probable sign of pregnancy? Like I said, this is commonly tested. These are things you see on the NCLEX. You have to master them. Which one? Visualization of the fetus or the ultrasound. Bluish discoloration of the cervix, vagina, and labia. Auscultation of the fetal heart sound and the breast engorgement and tenderness. Which of these indicate probable sign? You have to know what is probable, positive, presumptive, and then you can pick an answer. A presumptive means the mother is talking. Probable, you're doing exams. And a positive, you're using something to look for a baby. As you can see, based on that, B is a bluish discoloration of the cervix, vagina, and labia. That's the doctor describing it. Visualization of the fetus of the ultrasound is a positive, looking for the baby inside. And when you're listening for the baby, there's a proof of a baby live. Therefore, it's a positive sign. Engorgement of the breast and tenderness will be reported by the mother. Therefore, that's what? Presumptive. And so B is your right answer. Dose calculation. Don't run away. Simple question. If you run away from it, you're losing the point. And therefore, let's look at it. And nurse is preparing to administer IV ceftriaxone 1 gram daily to a client. The medication is available is 500 milligrams per 2 ml. How many ml should the nurse administer? That's all. Conversion, right? Dose calculation. Just basically, based on the question, we need to give 1 gram. 1 gram is what? It's 1,000 milligrams. That's all. But my medication coming 500 milligrams. I put 500 milligrams there. In what? 2 ml. In this cancel, you get what? 2. What do you have? 4 ml. Therefore, the nurse is supposed to give the patient 4 ml. That's all. Straightforward question. You don't have to worry about it. A nurse is caring for a hypertensive client who is taking bumetanide. That's what is similar to furosemide, right? It's a loop diuretic. Which parameters should the nurse monitor for while caring for the client? Select or apply. Potassium level, heart rate, uric acid, creatinine kinase, blood glucose, and water, and weight. This is a traffic question. I know you'll be tempted to pick so many things. Don't. Just go with the concept. Bumetanide is a loop diuretic. What would they do to the patient? That's all. Don't overselect. What do you think? What do you think? Put your answer in the comment section and let me know. Question 7. But I can tell you, bumetanide and furosemide, they do the same thing. They decrease your potassium level. They don't affect your blood pressure too much or your heart rate. Therefore, you don't need to worry about your heart rate. They are not like thiazide, hydrochlorothiazide, so your uric acid is not that affected. It does not affect your muscle, right? Creatine kinase. It's not cholesterol medication. Don't worry about it. It doesn't affect your glucose level too. Beta blockers may do that, or thiazide may do that. Your weight, because of fluid change, this is what we're going to do. And this is mostly they trying to confuse you with thiazide. Thiazide affect your uric acid, it affect your blood glucose. And so pay attention to that. And those are the things you should know. Only two answers. If you overselect, you lose point. And this is assessing a client with schizophrenia, psych nursing. I've been doing a lot of what? Psychosocial integrity question. Watch that series because you master this. Which of the following findings indicate negative symptoms? Select or apply. Aphasia, lack of motivation to perform activity of daily living is called avolition. Auditory hallucination, social withdrawal, disorganized speech, reduced speech. Which of this is associated with schizophrenia by negative symptoms? What do you think? Every time you see schizophrenia and you talk about what? Negative and positive, think about it. Negative, you're taking something away from somebody. If you take something away from somebody, they go down. Aphasia, what do you think? It's a trap, right? This is not Alzheimer's. Speech, they can talk, right? But the way they talk is different. Avolition, yeah, lack of motivation. You're taking something away from it. Auditory hallucination, you're adding something. That's what? A positive sign. Social withdrawal, you're taking away. Disorganized speech, you're adding something to it. And a reduced speech, alogia, is basically taking something away. So B, D, F are your right answer. This is the way you can answer questions regarding negative and positive sign so that it doesn't confuse you that much. So this is what you need. And this is observing a new graduate assessing a client with halo fixer device. Patient has halo device. Which action by the nurse will warrant immediate intervention? You have to know what an halo is. You use to stabilize the spine if you have head injury. Which one? The nurse performed cardiac assessment with the front plate in place. The nurse turned the client by holding the halo device. The nurse ensured that one finger gap between the vest and the client. The halo device was fastened while the client is in a supine position. Which of these need intervention? That means the nurse is doing something. This is physiological risk reduction question. What do you think? I can tell you, you should not hold the halo device. It's always a trap. Therefore, when you turn in the patient, don't hold the halo device. It's unacceptable. You're going to cause problem. But A, you can perform heart assessment with the front plate in place. And then you can ensure that one finger between the vest and the client. Halo device can be fastened while the patient is in the supine position, but never turn them while you're holding the device. That's unacceptable. You can log roll them. A client diagnosed with Tourette syndrome is on fluphenazine. Don't worry, Tourette syndrome. If you don't know, you can answer this question. The main point, buzzword is fluphenazine. I'm trying to teach you how to read questions and so you don't get distracted. Tourette syndrome has nothing to do with the question. It's a fluphenazine. Which of the following side effects should the nurse monitor for? You see, side effect, medication side effect, bradycardia, hypersalivation, weight loss, and hyperparexia. Which one should the nurse monitor for if you're taking fluphenazine? I can tell you the biggest problem associated with this is a first generation antipsychotic, what? NMS, and therefore high temperature. Weight loss, they're going to gain weight. Hypersalivation associated with antipsychotics, but not most, first generation is not that great, and they don't cause bradycardia. But your temperature is going to get high, and you will have what? Neuroleptic malignant syndrome. And this is assessing 150-pound client who present to the emergency room with deep partial thickness burn to the entire posterior torso and the left upper extremities. How many ml of fluid should the nurse administer in the first 8 hours? This is maybe the hardest question you may see on the NCLEX, but it's actually easy. How do you approach it? Know your burn formula and what you need to do. First, 150 pounds, we're going to convert it into kilos. You can use it. So we divide it by 2.2, and we're going to get 682 kilos. And that's done. right? That's the first thing. And now you have to know how to calculate the body surface area that is burned. We have deep partial thickness to the entire posterior aspect. Your back is 18. The left upper extremities, your upper extremities is 9. And therefore, this will give you what? 27. So total body surface area that is burning is 27. Then you use the Parkland formula, 4 times the total body surface area times the weight. It's straightforward, right? And this is going to give you 7,363 liters of fluid. That's a lot of fluid. But guess what? In the first 8 hours, you just give them half of that. Therefore, we're going to give half. It's divided by 2. That's going to give you 3 liters. If you have a problem, watch this portion multiple times. But the actual question is straightforward. You just have to know the concept and how to move around. And therefore, that's your right answer. It's a dose calculation question. Case study. Don't run away. This is a Bowtie question. What do you do? Click on it. And what do you do? Go for the buzzword. And next in the outpatient clinic is assessing a 35-year-old client who report excessive daytime sleepiness. That's your buzzword. When you see that, read the first statement, and then you should figure out what is wrong with the patient. Excessive daytime sleepiness and morning headache. That's keywords. The client state is unable to keep up with his daytime job. This is affecting the job and has been placed in what? Suspension. Is in trouble. The client reports, SPA report what? Loud snoring during the night and frequent waking up in the middle of the night, and is gasping for what? This should give you the diagnosis right away. He needs nasal congestion frequently. These are the vitals. I see a little bit of blood pressure elevated. I see what the BMI that is high. You got to put all these together as you read it. Rented times 3, dry mucous memory, long sound caused at long basis. There's no murmur. S1, S2 is present. Abdomen is fine. No pedoedema. Usually the physical exam, just look and see if there's any concerning. If there's any, just breeze through quickly. He has a history of what? Hypertension, and he smoke. That's all. Did you figure out what is wrong with the patient? If you figure out what is wrong with the patient because he has excessive daytime sleeping and then he's waking up in the middle of the night, gasping and snoring, that should give you a clue. Those are the buzzwords you can use to answer the question. The next is review the clinical data. Specify which condition the client most likely experiencing. Is this narcolepsy? Is he obstructive sleep apnea, asthma, depression? If it is so, what action would you take? Prescribe antidepressant, educate the client on smoking cessation, prescribe polysomnography, nasal decongestant, do allergy testing, or what do you monitor for? Blood pressure, sleeping pattern, suicide ideation, wheezing, and sleepwalking. You can tell from the question that this patient has a sleeping problem by waking in the middle of the night and is affecting his day job. It's not just falling asleep. Falling asleep is what? Narcolepsy. But waking up in the middle of the night, this is obstructive sleep apnea. And therefore, what are we going to do for this patient? Well, he does not need antidepressant. We got to tell him to stop smoking. Smoking is not good. And then he needs a sleep study. This is a sleep study. Prescription of polysomnography. Nasal decongestion was a trap, right? He does not need allergy testing because this has nothing to do with allergy. His blood pressure is elevated. Those are the things you're going to monitor for. And then his sleeping pattern, so they can help. You tell him certain things to do so that he doesn't wake up in the middle of the night, stop daytime sleeping, and that will help him. This is obstructive sleep apnea. There may be another question. They may ask you specific medication they're going to give them, how to prevent sleeping, but not to fail. You have to know. If you need more, check Adapt NCLEX on the sleep apnea. This is something that shows up all the time on the NCLEX. So you should know it. Therefore, this patient has sleep apnea. We're going to do what? Smoking cessation and do a sleep study. That's polysomnography. That's sleep study. Check your blood pressure and sleeping pattern. This is not suicide or wheezing and sleepwalking. It's not narcolepsy. And that's that case. How did you do? Did you get all of them? Bowtie question, always make a diagnosis. What do you need to intervene and what you need to monitor? Never leave that question behind. You get 5 points if you get all of them. There's no penalization of wrong answer. What is your score so far? If you're tired, pause, take a break, come back. We have 85 questions. We're going to master this and then pass this test. And this is caring for a client who became increasingly agitated on the unit. Which of the following actions should the nurse include in the de-escalation process? Agitated is going to cause a problem. How do you bring everybody down? Maintain a calm tone of voice. Stand directly in front of the client with the arm crossed. Decrease environmental stimuli when possible. Attempt to redirect the client. Touch the client to what? Provide reassurance. Use clear, concise communication. Somebody is agitated. What would you do? How do you calm them down? What do you think? Think about it. Calm voice, better. Pick your answer. You want to stand directly in front of the client with your arm crossed? No, it's going to be more agitated. Decrease environmental stimuli, very good. Redirect the patient, very good. Don't touch them, they're going to get mad. And use clear, concise communication when you're dealing with this kind of patient to direct, you're not hiding anything. And this is how you deal with somebody who's agitated. And then it's providing education and community health about osteoarthritis. Which of the following is considered a risk factor for this condition? Select or apply. They were going to compare with rheumatoid arthritis. What is the risk of osteoarthritis? Obesity, smoking, advanced age, female gender, and a moderate physical activity. What do you think causes osteoarthritis? It's due to stress. And third, therefore, you pick an answer. Pause the video and pick your answer. As you can see, obesity is common. Smoking cessation is another most number one cause of it. If you are older, advanced age. Female, unfortunately, due to estrogen level. And this is a trap. Less exercise causes osteoarthritis. Moderate physical activity is good. Therefore, A, B, C, D is your right answer. And this is evaluating a client in the emergency department with suspected lithium toxicity. Which of the following findings should the nurse anticipate? Select or apply. Includes lithium. Therefore, know this. Write it down. Put your pen and paper. Stop the video. Blur vision, severe diarrhea, muscle weakness, polyuria, and hypotension. Which of these should the nurse anticipate? What do you think? And I'll give you a trick to answer this question next time if you get it wrong. You pick your answer. Every time you see lithium, think about when you have toxicity, you have neuro problem. It's going to affect your kidney. And it's going to cause GI symptoms. GI symptoms is number one. So what the nurse is going to monitor is all these three, right? That's the key. Blur vision, neurological problem, severe diarrhea, GI symptoms, muscle weakness, neurological problem. You see how I'm answering the thing? Polyuria is kidney problem. Nothing to do with this. And then you don't get trapped. Neuro, GI, kidney, every time you hear about lithium, those are the things you should worry about. That's how they're going to present. And the number one is the GI symptoms. So that's how you can answer this question to get all 4 points. Which of the following interventions should the nurse prioritize? Prioritization that you need to know for your NCLEX. The nurse is caring for a client in postpartum unit who became increasingly anxious and agitated after a newborn is taken to the nursery for a routine examination. Mother gave birth, worry about the baby being taken away, and anxious about it. What do you do? Coordinate family meeting to discuss comprehensive postpartum care, recommend anxiety medication as soon as possible, educate the client on coping strategies to manage anxiety and offer support presence, and what? Administer antipsychotic medication as prescribed. What do you think? Which one would you prioritize in this situation? Mother is in a postpartum unit, increasingly anxious and agitated after newborn is taken to the nursery. What do you think? The right answer is C. The mother is probably having early signs of postpartum and depression, anxiety related, but it's okay. There's no need to treat them. You need to educate them so that they can cope. The baby is just going for nursery. We are not stealing the baby. So these are the things you have to teach the mother. Coordinating a family member is okay, but it's not the priority number one. Anxiety medication will be the last thing we're going to do. We're not going to prescribe antipsychotic. Negative. And this is assessing a client with tricuspid valve murmur. Which of the following locations should the nurse auscultate to best hear this murmur? You have to know the location of tricuspid valve. If you don't know, I have a video, cardiology. You should watch it. It will show you all the steps you need to find. But as you know, this is on the left side. That's number one. If you know it's on the left side, then you can eliminate it. But I give you all left. The second thing is lower, is closer to the mitral valve, right? And therefore, if the mitral valve is number 5, what do you think is the tricuspid is going to be? This is the strategy to answer the question. It's on the 4th level. The 3rd is the Erb's point. And the 2, usually you are in the pulmonic region. But this is the way I want to think about it. There's pictures all over the internet. It will show you the location of the murmur. This is easy point, grab it and move on. Know where they are located and then study about them. And this is caring for a 3-year-old with ventricular septal defect on pediatric unit. When students, nurses see this kind of question, they panic. It's easy, VSD. Just focus on the VSD. It's left to right shunt. The rest of the question is based on left to right shunt. What do you know about it? Which of the following findings should the nurse suspect? You don't have to memorize what is VSD is. So far as you know, it's a cardiac defect, and this cardiac defect lead to left to right shunt. Therefore, you have oxygenated blood going back to the lung. I'm just leading you for the answer so that you can think about it. Easy fatigability, finger clubbing, bounding peripheral pulses, hepatosplenomegaly, respiratory rate of 57, cyanosis during feeding, and weight gain. I've given you the clue. You don't have to pick everything. You don't have to pick everything. Pinch yourself. Pick those that you are 100% confident and move on. What do you think? Number 18. If I'm sending blood back to the heart, I'm going to cause CHF and pulmonary congestion. That's all. VSD, ventricular septal defect. Blood is moving from your left to the right. It's going to go to the lung back. Therefore, I have CHF and pulmonary congestion. Every answer choice based on that. Don't worry about the VSD anymore. And therefore, I'm going to get tired all the time. You see, I know a lot of people is going to pick finger clubbing. That's what? Right to left shunt. It's a trap. Don't pick it. Bounding peripheral pulses. If you have pulmonary congestion, your pulses are not going to be bounding. This is probably PDA, pectin ductus arteriosus. If you have CHF, yes, you're going to have splenomegaly. You see how it's the hepatosplenomegaly. You see how it's coming? Well, if you have pulmonary congestion, your respiratory rate is going to go up. They're not going to be cyanosis, okay? They get what? Diaphoresis when you're feeding them. Know this. This question is hard, but it's not. It's our concept. And you're going to lose weight because your metabolic rate is going to go up. Therefore, weight gain is not expected. You think because they have CHF, they're going to gain weight. But because their metabolic rate is going to increase, they're going to have poor weight gain. This is the way you answer this question. If you get it wrong, it's okay. Just I've given you the buzzwords. Next time when you see it, you will not go wrong. And this is performing medication reconciliation of a client with the new prescription for warfarin. Which prescription in the client medication list should the nurse notify the healthcare provider about? That means you're taking warfarin and you're taking another medication. Which one should I worry about? Because it's going to cause the warfarin to make you bleed more or have a DVT. There's one medication, if you don't know at all about warfarin, that you should avoid, tell the patient to stop taking it. It's not what? Anything vitamin K dependent factor diet. Not that one. This is very important. Calcium supplement, antacids, Bactrim, and then acetaminophen. This is sulfur, metazole, and trimethoprim. Keyword, antibiotic. Always react with what? So warfarin. Therefore, if patient is taking antibiotic, you need to talk to the doctor. This is an antibiotic. It's the most common cause of affecting warfarin and bleeding. after what? Vitamin K dependent factor. They have to remain on it consistently. But antibiotic, if you see a question on the warfarin and they give you a list of medication, look for antibiotic. That's a clue. You master that. Case study. You want to run away from it? No, let's get it. Let's face it. What is the problem? Client was brought in by a bystander following a motor vehicle collision 60 minutes prior to the arrival. The client was the driver of a South Sudan that collided with the ongoing vehicle. There's a car accident, trauma. Bystander report that the client lost consciousness at the scene and experienced one episode of projectile vomiting. If you have an accident and you are projectile vomiting, that means you have high ICP. The client has a lucid interval and regained consciousness. That's a buzzword. He lost consciousness, came back, and it's been about 50 minutes and has remained awake since then. The client is currently unable to speak now, and he cannot ambulate. What do you think is going on? They give you vitals, look at it. If you see anything abnormal, pick it. There's bruising over the forehead. Patient is alert, opening his eyes spontaneously. That's good. He responds inappropriately to question. That's not good. He tends to painful stimuli. That's telling you they're localizing, right? No murmur, long sound caused at basis, abdomen fine, there's bruising over the knee. They've given you some neurological thing. I've told you when you read the physical exams, there's something that should clue you on that these are bad stuff, right? He's alert, good, but he's opening his eyes spontaneously. It's also good. Responding inappropriately, not good. He's tending to stimuli, right? He's not able to ambulate. That's not good. So these are things that should clue you on that this patient is having a neurological problem after the car accident. And so, which of the following are concerning? Well, he opens his eyes spontaneously. What else do you want? I don't know. I'm asking you. Pick your answer and let me know. His blood pressure. What was his blood pressure? 118/70. There's a lucid interval, short interval after he had the accident where he lost consciousness. Then he's now having projectile vomit. His lung is caused at the basis. Which one should concern you? It's a select or apply. Don't over-select. Pick those you're confident. What do you think? Well, if you open your eyes spontaneously, wrong. Nothing wrong with it. Blood pressure was normal. Lucid interval is not good in this patient. We have a problem. And I having projectile vomiting. That is ICP. Long course at basis, expected finding. There's nothing wrong with it. What is your GCS? Well, you got to calculate it, right? You got to calculate the GCS. He opened his eyes spontaneously. His E is what? 4. What is verbal? Inappropriate to the respond, not incomprehensible. That's what always the NCLEX will trap you. Incomprehensible is 2. And inappropriate is 3. It's not responding appropriate. When you ask him, what is your name? He said, Monday, right? That's inappropriate. Incomprehensible means you can't even hear them. They're murmuring, right? So this one will be 3. And when you localize, you get 5. And therefore, this patient is what? You're going to get 12, GCS of 12. Learn how to do it. If you can't calculate GCS, a video on GCS on my channel, you can watch it, and this will help you. Now we got to manage ICP. You have to learn how to manage ICP. The nurse has reviewed the clinical data. Which of the following should the nurse anticipate in the plan of care? Select or apply. Well, 0.45% normal saline infusion. You want to give it to the patient who has head injury. Prepare for intubation. Do you want to do that? Do neurological assessment every 4 hours. Is that good? Monitor, give them monitor infusion. Give them heparin sub-Q. Raise the head of the bed to 30 degrees and get a CT scan of the head. This video is going to teach you so many things. If you don't know, take notes. I don't care about your score right now. I want you to master the content, but the score will boost your confidence. It's okay. Just make sure you understand every concept we're talking about. You have to know ICP and how to manage ICP. You pick your answer? Did you pick your answer? If you have a brain injury, we're not giving you 0.45%. That's hypotonic solution. We got to give you hypertonic, 3%. Prepare to intubate the patient. Well, we don't, because his GCS is 12. If you have GCS less than 8, then we got to prepare to intubate. That was a trap. Neurological assessment every 4 hours. That's too long. Every 1 hour. Monitor infusion. That's good to improve your ICP. We're not going to put heparin sacule on because we're going to bleed. And we got to raise the head of the bed and then get a CT scan, non-contrast. We did get a CT scan and we get large epidural hematoma with the midline shift. That means if this is the brain is now like, this is the midline. So this is the brain, right? Or in the here. Now we have the brain all squished here like that. And this is the midline. So there's a midline shift. The brain is being squished by blood. We have a problem. What do? Prepare for surgery, get another CT scan, pain medication, keep the head in the midline and neutral. This is a no-brainer. We got to go to surgery and decompress the head. Which of the following finding is concerning for increasing ICP during assessment? You have to know this. ICP is something common. You may get it, you may not, but at least you know it. So you know what are the signs of bad ICP. Narrow pulse pressure, irregular breathing, tachycardia, anisocoria, that means unequal people, and what? Hypotension. So watch this portion very carefully because it touched a bunch of stuff. What do you think? This is a trap. High ICP is going to cause what? Wide pulse pressure. Your systolic will be higher than your diastolic. Therefore, this is a trap. It's a wrong answer. You're going to have irregular breathing. We call it change stroke breathing. And you're going to have bradycardia. So they have hypertension and bradycardia. I'm testing your what? Cushion triad, right? They're going to have unequal people. That's it. And they're going to have hypertension. So this is not hypertension. It's testing everything you need to know about ICP. The ICP is elevated, 25, by the monitoring device. Which action should the nurse take now? What do you want to do? Administer prescribed monitor, lower the head of the bed to a flight position, elevate the head of the bed to 30 degrees and keep it midline, suction the client to clear secretion. The ICP is elevated. Do you give them monitor? You lower the head, or you elevate it, or you suction them? Test taking strategy. There's two answers that are contradicting each other. Even if you want to pick A, don't, because strategy to answer question, even if you don't know. Why would they tell me to lower the head? And then C said, elevate the head. I got to pick one of them. Don't pick medication. 2 is telling you, hey, lower the head is bad. If I know if I drop the head for ICP is bad, I'm going to elevate the head. That's the right answer. Number 1 is not bad. The question says which action you should take first. Prioritization 101, elevate the head. And that's your case study right there. How did you do? This, you got to master it. ICP monitoring. I want you to watch that area again if you have problem. And this is everything you need to know. You can write the concept down when you see ICP question. 21. And this is educating a 14-year-old diagnosed with cystic fibrosis. Which of the following statement by the client indicate the need for further teaching? Cystic fibrosis, content, they have lung problem and pulmonary and a GI problem. You got to teach the mother. I will keep my immunization up to date. Is that okay? I should avoid exercise to reduce shortness of breath. I will take my pancreas enzymes 3 times a day. I will limit exposure to sunlight to avoid dehydration. I will reduce sodium in my diet. I will restrict fluid to prevent mucus buildup. Which of these indicate further teaching is needed? That means they are not appropriate regarding to a patient with the cystic fibrosis. What do you think? Like I said, you don't have to over-select. If you know only one, pick it and run away. Otherwise, you lose point. Immunization up to date, you're going to have infection. That's a good thing. You should not avoid exercise. Don't exercise when it's hot outside, but exercise to improve your lung function. I will take my pancreas enzyme 3 times a day. This is a trap. A lot of people will pick it. If you pick it, that's ankle strap. Write it down. Ankle strap is this. The medication is not taken scheduled. It's taken when you eat. So when you're eating snacks and food, not 3 times a day. So don't pick C. I will limit sun exposure to avoid dehydration. Yes. You should not reduce the sodium. You need more sodium to pull on water. And you should not restrict your fluid. This is cystic fibrosis. All the answers are a bunch of trap. If you overselect, you're not reading the question well. Sorry, but pay attention to details. And this is reinforcing this short teaching with the breastfeeding client who has what? Mastitis. Which statement by the client indicate correct understanding of the teaching? Same thing. It's a key concept. Maternal health. This is what? Health promotion. Mastitis. Inflammation of the breast. What do you teach them? I will alternate breast during feeding. I should wear a tight feeding supportive bra to help reduce discomfort. I can take over-the-counter ibuprofen for pain relief. I should avoid massaging the affected breast while breastfeeding. I will offer unaffected breast more frequently. I can apply warm compression to the breast before feeding for comfort. Don't pick the answer if you get trapped, because there's trappy answers in it. I put it there to make sure you pay attention. There is words in the answer choice that can throw you off. Even though it look nice, it's wrong. You pick your answer. Question 22. Alternate the breast. You can feed from both breasts. Tight feeding will prevent breast milk from coming out. So do it. Don't do it. Is that okay? Which one is good? Is a trap. As usual, right? If you said I should wear a tight feeding supportive bra to reduce discomfort, but at the same time, it's going to prevent breast milk from formation. Therefore, we want breast to come out. I can take over the counter medication for pain. That's good. I should avoid massaging the affected breast while breastfeeding. No, you should massage to make as soon as if you can empty the breast, that's good. I will offer the unaffected breast more frequently. No, you should alternate. Is violating question answer 1. You see how I do it? Go back, look at the answer choice. Don't just pick it. Warm compression will allow more blood flow and therefore head the breast to empty. These can be quite difficult questions, but you got to look at the answer choice carefully so that you don't get trapped. And this is assessing the client diagnosed with bulimia nervosa who frequently purges. You purges, eat, and then pour everything out. Which finding could the nurse anticipate? If I have to put my hand in my mouth to purges, you should figure out certain things I will see on physical exams. It's not rocket science. It just come like that. Medicine, sometimes some of these things just come. You can think about it. Calluses on my knuckles, right? Dental enamel erosion. What do you think? My BMI is 18. I have fine downy hair on the arms and back, and I have jaundice. What do you think? A bunch of traps. If you put your hand in your mouth, your teeth will be rubbing the back of your knuckles, and you have scar there. This is calluses. This is rosacea. The acid is going to erode your enema. Nervosa, bulimia, their BMI is normal, 18 is low. They usually don't have lunugos, that's anorexia, and they don't have jaundice either. It's a trap. This is your answer choice. Did you get it? I hope so. And this is providing teaching to a parent of a child recovering chemotherapy for a blood-borne malignancy. Which of the following teaching should be included in the teaching? Selected, apply. Read the question again. And nurse is providing teaching to a parent of a child receiving chemotherapy for blood-borne malignancy. Forget about it. This is designed to trap you. It means they're getting chemotherapy. They have cancer. What teaching should you provide? Make the question your own. Rewrite it your own so they become easy. Check the child rectal temperature twice a day. You want to check it, somebody getting chemotherapy has cancer. Provide soft Bristol toothbrush for the child. Do you think it's necessary? Ensure the child receive oral influenza vaccine annually. Is that okay? Keep live flower pot in the child room for coping. Why would you do that? Provide fresh daily meat to increase protein intake. A bunch of traps. Do you think it's okay? Pause the video, put your answer in the comment section, but don't get trapped. If I trap you, sorry, but I want you to master and pass your NCLEX. That's all. I don't care about anything. So far as you passing, everybody is happy because it's a hard test. You've done a good job so far. Therefore, continue on the hard work. Keep charging as always. Adapt NCLEX way. You pick your answer. Don't let me trap you. Check the child rectal temperature twice daily. Never put anything there. Going to cause perforation, infection. Soft bristle toothbrush. Yeah, you're going to bleed. The child receive what? Oral influenza vaccine is a live vaccine. If you're getting chemotherapy, negative. You should not get it. A live what? Flower pot is unacceptable. It's also going to cause infection. And you should not go eat any fresh daily meat. Even though it's an increased protein, that's a trap. As you can see, one answer. You over-select, you lose point. This was intentionally set to make this question harder. But now you know. Attention to detail, adapt NCLEX way, and then continue to be sharp when you select your answers. Recheck it again, recheck it again. And this is assessing a client who has with waxy flexibility and echolalia. Echolalia and waxy flexibility. Which underlying condition should the nurse suspect? What condition will you see a patient who has waxy flexibility and echolalia? Bipolar disorder, depression, schizophrenia, and delusion. You have to know what is waxy flexibility and echolalia. Even if you don't know waxy flexibility, echolalia means when I say something, you repeat it, right? How are you? How are you? Are you okay? Are you okay? Who would do that? Bipolar will not do that. Depression patient will not do that. Delusion, no, they don't even want to talk to you. Schizophrenia is that patient. So, the waxy flexibility is catatonic features that the individual will exhibit. A client is receiving enoxaparin therapy for pulmonary embolism. Which assessment finding require immediate intervention? Selected, apply. Platelet count is 50% of the original. Bruising at the injection site. Malignant. Hematuria. Emesis with the coffee ground appearance. Bilateral frank ecchymosis. What is the question testing? Rewrite the question. Don't let me trap you. I don't want that. Don't let the NCLEX do that either. Underline the buzzword. What is the problem? Enoxaparin. It's anticoagulation for pulmonary embolism. It's not asking you about pulmonary embolism if you look at the answer choice. It means anticoagulation, complication, platelets, 50% of the original, bad problem, hate, heparin-induced thrombocytopenia because enoxaparin is heparin. Bruising at the injection site. What do you think? Is this expected or non-expected? It's expected finding. If you have bowel movement and it look dark, bad problem. If you pee and it look dark, bad problem. If you cough and it look like coffee grounded and you have bilateral ecchymosis, what do you call that? That's retroperitoneal hematoma. That's greater sign. Bad problem. Bad problem. We got to fix this patient. So this patient, A, B, C, D, E, and F are all something you should worry about in the patient having anticoagulation, whether warfarin or enoxaparin. But you don't have to over-select. Just pick those with confidence. And this is an emergency department is assessing a client suspected of having postpartum psychosis. Which finding should the nurse suspect? You have to distinguish between psychosis, postpartum, blue, and depression. Which one is postpartum psychosis? Severe insomnia, excessive energy and pressure speech, disorganized behavior and rapid mood swing, hallucination, paranoid delusion, impaired reality to testing. Don't overthink the answer choice. Take psychosis, unravel it, and say, if somebody has psychosis, what are the things I will see in the common psychosis patient? That's all. They're not going to sleep. You pick your answer. I'm coming. They don't have excessive energy and pressure speech. That's bipolar patient. You're going to have disorganized behavior and rapid mood swing. That's what you're going to see in this kind of patient. Hallucination, no brainer. And he will have paranoid. If you're paranoid and you have hallucination, reality is bad. They don't even know whether what they're seeing is real or not. So impaired reality. In this, look, you don't have to pick everything. I made the test the way so that you can learn it. Next time, you don't get trapped. Following a large volume paracentesis, that means if you have paracentesis, we do it in the patient who have ascites. That means you're taking their fluid from them. Which intervention should the nurse anticipate to reduce the risk of hypovolemic shock? This is a trap, right? When you have you do paracentesis, we do it for patients who have CHF with a big belly because of ascites, and then or portal hypertension. When we remove all the fluid, they become hypotensive. What do you do? That's what the question is asking you. He said, what do you do if you do large paracentesis? Change it, right? What would you anticipate to give it to the patient if they get sick, in shock? You pick your answer. Did you pick your answer? Don't pick A. 3%. You don't give it to this patient. And neither normal saline, 0.99%. You give them albumin because they have ascites, because they like protein. If there's no protein, they develop ascites. If you take their fluid in order to prevent ascites and then hypotension, just give them fluid. Otherwise, if you give them normal saline and 3%, they have more ascites. Straightforward. And this is provided teaching to a caregiver of a client with Alzheimer's disease. Which instruction should the nurse include the teaching? Select and apply. When you're dealing with the Alzheimer's patient, be patient. Don't force them. Give them time. That's the strategy. Use simple, short sentences when communicating with the client. Maintain a consistent daily routine for the client. Place Locke's eye on the door to reduce wandering. Encourage the client to make complex independence decisions. Encourage the client to engage in financial decision to promote independency. Provide finger food to promote independent eating. There's something about test-taking strategy. If you know the concept of Alzheimer's, I just told you, don't force them, allow them time, don't make things complicated. The more you test their memory, the more they get confused. The NCLEX is not going to ask you that. They will describe something that means the same. So don't think they're going to say the same thing. But the thing you're taking is the concept I'm giving you is the same thing. It's just written in a different way. So take whatever they've given you and translate it to that concept. That's all. I'm teaching you how to answer questions flawlessly. Simple, short sentences when you're communicating with the client. That's what I said in the different language. What did I say again? Maintain consistency daily for a client. I said, don't test their memory. If you have to change things, you're confusing them. Consistency. You see, I'm going through them so that you can see. Place a log high on the door to reduce wandering. Allow them time. They're going to go out. But what? If you play the log high, they can't get out, right? That's all. Encourage the client to make complex decision independent. I told you they can't do that. You're going to get confused. Why would you let them do that? Encourage the client to engage, look, in financial decision to promote independency is a trap. Let them make the financial decision, involve them to promote, like, so that they know they're doing something. Guess what? They cannot do that. D and E are saying the same thing. Provide finger food to promote independent eating. Well, yes, because they don't want to sit down and eat. So that one is good. You don't want to be feeding them all the time. Finger food is in your hand. Use that kind of strategy to answer these questions whenever you see them. And next is providing medication teaching to a client prescribed Alendronate for osteoporosis. The good thing, I tell you what it's for, but then you have to know side effect. Which of the following statements indicate further teaching is required? Alendronate for osteoporosis is a medication we use for osteoporosis, but you have to know something about it. I will give you a clue. if you know levothyroxine, things you do for levothyroxine, then do the same thing for alendronate. I've given you the clue. You should be able to answer that question flawlessly. Things you do for levothyroxine is the same thing. So which need further teaching? I should take it first thing in the morning. I should remain upright for at least 30 minutes after taking the medication. I can take it with a small glass of orange juice. I should take it once weekly. You can take it with anything. It's like levothyroxine. Early in the morning, empty stomach, upright 30 minutes. Unfortunately, this one you take it once a week, levothyroxine daily. So that's the things you got to look, compare medication so that you can master them. And this is reviewing clinical data. Which two of the following require immediate follow-up? Client with the history of congestive heart failure present to the emergency room. He has CHF. His blood pressure is elevated, slightly tachycardia, saturation 95%. He's oriented to time, place, and he has no mama S1 is present. His sound crackles at the base and he's using accessory muscle. His abdomen is soft, non-tender, non-distended, but his liver is palpable. So you have a hepatomegaly. He has class 2 edema. Look at it again, pause the video, think about it. We're supposed to pick things that is concerning. What do you think? You look at it? Good. They say pick two. Two things that you think is bad. 2 edema, bilaterally. He's using accessory muscle and his lung is caused crackles. His saturation is 95 on room air. His blood pressure is 189/95. He has a history of CHF and his heart rate of 105. Don't pick. Okay, think about the situation. Patient has CHF and he came in with this. All the numbers may look abnormal, but you have to think critically. Which of these is going to affect the patient? Said, require immediate follow-up that you can fix right away. That's all. Don't pick edema. I mean, it's not a priority at this time. The thing is affecting the lung, accessory muscles, crackles in the lung. The saturation 95 is not bad. Blood pressure, and this, which one would you pick? I'll pick blood pressure. He has history of CHF. We already know. Heart rate, blood pressure outweigh this one. Therefore, those are the one I pick. But this can be a little bit, I mean, I know you can pick certain things, but you got to think through what is going on with the patient and say, which one, if this is my patient, which one would I pick? If you pick different answers, put it in the comments, let me know and explain yourself. I'll give you the point. And this is caring for a 30-year-old client in the emergency room. The nurse has reviewed the clinical data, named the condition the client most likely experiencing, 2 actions to take, and parameters. Another Bowtie question. So we got to figure out what the patient have. A client is brought into the emergency room by a law enforcement officer after being found wandering. He's just wandering aimlessly in traffic and talking to unforeseen person. The client appeared disoriented. He's restless, increasing suspicion of staff members. You can see this is a side question. During the assessment, the client refused to answer most questions. He stated that people are watching me. Is he hallucinating? He's unable to provide clear information regarding identity and location. He doesn't know who he is. The client is pacing continuously around the room. He avoided eye contact and refused offer food because he thinks you're going to kill him. Delusional? These are the vitals. When you check the urine, there's no drugs in it. And he has no medical history. Read it again. What do you think is going on? He's wandering around aimlessly. He's talking to himself. He's not talking to anybody. He says somebody is watching him. It does not sound good. Is this a bipolar patient? Is that how they're going to behave? The clue for what Bowtie question, always go in the middle. Find the condition first. When you find it, make an action. Don't pick an action without knowing what is the problem. After you pick the action, then what you do is you just fix the action, you just monitor it. Therefore, what is the problem? This is not bipolar. This is not schizophrenia. If it's schizophrenia, if you pick it, it's okay. I will explain to you because he has no all the features associated with it. And schizophrenia does not occur acutely because I say he has no medical problem. So if you pick it, sorry, but that's a trap, right? He has no medical problem. It just happened. And this is a psychosis, acute psychosis. We said there's no drug. If this is acute psychosis, what are you going to do? That's the thing. What are we going to do about this patient? Psychiatric consultation, administer fluphenazine, provide finger food, provide calm environment, establish rapport with the client. And then after you figure out sleep pattern, catatonic features, alertness, side effect, and that. So everything here is connected to here. So if you pick a wrong diagnosis, then you're going to follow them in terms of your pattern. So make sure you pick the right one. So we said this is a psychosis patient. If this is the psychosis, what are we going to do? First action you can take, not to call psychiatric nurse to come and take care of this patient. You can do your job. It's not medication. It does not need finger food. That's not bipolar patient. Provide calm environment. And then establish report. It doesn't want to trust anybody. And after you do that, well, we know patient has psychosis. Okay. They agitated. So we got to provide some agitation, monitor them for agitation, and then arrange them to place and time and space. Very, very important. But as you can see, this patient has psychosis. So provide calm environment, establish report with them, and then make a diagnosis associated with that. And this is the way you should manage this patient. It can be very trappy, but psychosis, this is the way you manage them. And this is implementing droplet precaution in the several clients. For which of the following condition these measures are appropriate? Look, sometimes you see words in the question that you don't know what they're talking about. But what I'm saying is droplet precaution. What do you do? It's just a bunch of words. Which organism do you do that for droplet? Pneumocystic pneumonia, pertussis, scarlet fever, rubella, impetigo. What do you do for this condition? Droplet. Which one is for droplet? I just made a video on infectious control. You should watch it. The best video you will see. It teaches you everything. It's on my channel. Check it out. Droplet precaution, pertussis. What else? Which one you pick? Scarlet fever. Rubella is airborne. Impetigo is what? Contact. Pneumocystic pneumonia is what? Standard precaution. This is fine HIV, immunocompromised patient. No infectious control because they are straightforward. They're not going to trap you. If you know it, you pick your answer and you move on. And this is educating a 15-year-old client with asthma on metered dose inhaler. Which of the following statement by the client require follow-up? Selected apply. I should wait for 1 minute between puffs if I need more than one dose. I will need to shake the inhaler before use. I will tilt my head slightly to the back when using the inhaler. I should hold my breath for 5 seconds after each puff. I should rinse my mouth with water before using an inhaler. This is something you have to know because asthma is prevalent and they're going to ask you, metered dose inhaler, how do you teach the patient how to use it? And it's a required follow-up. You pick your answer? Did you pick your answer? I can tell you, I should hold my breath for 5 seconds. I should wait for 1 minute between pop if I need more than one dose. Yeah, that's expected. I will need to shake the inhaler before use. That's good. I will tilt my head slightly to the back when using it. That's good. I should hold my breath for 10 seconds, not 5 seconds after each puff. Then wait for a minute before using the next one. You don't need to rinse your mouth when you're using inhaler, unless you have some steroids. And this is caring for a client with peripheral vascular disease, that's PAD. Which site should the nurse use to obtain the most accurate site for oxygen saturation. Your forehead, your finger, your toe, and your lobe. You've been on the floor before. When you need accurate determination and a patient who has peripheral arterial disease, that means blood flow to the extremities is weak, where will you place it? This is what he's asking you. If you interpret the question, that means your toe is dead, your finger is dead, your forehead, you got to be in a specialized place. Therefore, your earlobe is the best place. And this is caring for a client with serum sodium of 125. Which of the following prescription would the nurse anticipate? 3% normal saline, 0.9% normal saline, lactate ringers, 0.45% normal saline. Which one would you give for a patient who has hyponatremia? What do you think? You should not give them anything less than 1%. Therefore, this is gone. Lactate ringer is gone. This is less than 1%. We're going to give them 30%. After attending a staff education program of malignant hyperthermia, the nurse should recognize that which inhaled medication can trigger this condition. Did you understand that? Pay attention. Nitric oxide, allotane, seasonal cohe, and then what? Seasonal colon, and then Amiodarone. What a question is saying. Which of these can cause malignant hyperthermia? That's all. Rewrite it. Which one? And the word is inhale. If you don't pay attention, I will trap you. Inhale. Which of those, if you don't know, you think you got to inhale it. I know you can inhale Amiodarone, but does that cause malignant hyperthermia? Don't pick it. This does not do that. This does not do that. This does not do that. Do you think so? If you eliminate Amiodarone, you have three options. Which one will you pick? This is an IV, but it causes malignant hyperthermia. This does not. Your right answer is B. This is the way the NCLEX sometimes will trap you with questions. Therefore, that's the right answer. NCLEX love this question. And this is caring for a client newly diagnosed with myasthenia gravis who is prescribed physiostigmine, right? Which client condition should cause the nurse to question the prescription? That means if you're taking this medication, I should worry about it. Selected apply. Asthma, peptic ulcers, hypothyroidism, COPD, diabetes. This question requires you to think a little bit. What is physiostigmine? And what is the problem with the myasthenia gravis? The pathophysiology means they need acetylcholine. Therefore, if I give you neostigmine, you're going to have more acetylcholine. Which condition more acetylcholine is bad? That's all. Is acetylcholine bad for asthma, peptic ulcer disease, hypothyroidism, COPD, and diabetes? If it's so, pick it. Yes, it's bad for asthma. That's why we use anticholinergic. Acetylcholine is cholinergic. Anticholinergic is used to open the airway, so it's bad for asthma. It's also bad for peptic ulcer disease. It causes more bleeding. Hypothyroidism, it does not affect it. If it's bad for asthma, COPD is also bad for it. It does not affect diabetes. It's a little bit tricky question, but it tests your knowledge on acetylcholine and these conditions. So if you know somebody who have myasthenia gravis, there's certain things you should know. And then she's teaching the client about the use of transdermal fentanyl patch. Which of the following statements indicate correct understanding? Select or apply. I will apply the patch to clean, dry, hairless skin. I can cut the patch in half if the full dose is too strong. I should rotate patch site with each application. Heat, like a heating pad, can increase absorption of the patch. I will fold the patch and flush it down the toilet when I remove it. I should report difficulty breathing or excessive drowsiness immediately. Indicate correct understanding of taking fentanyl patch. Select or apply. What do you think? Pick your answer in the comment and let me know. Let me know. What do you think? Yes, apply it, dry, hairless skin. Don't cut it. If you cut it, you're in trouble. Rotate the site after each application. Don't apply heating pad. You cause more absorption. That's why we use patch. That's very important. Why do you want to flush it in the toilet? I don't know why you want to do that. Just put it in the garbage. I should report difficulty breathing and excessive dryness. This E is a trap, right? You should not flush it over the toilet. You should dispose it based on the facility protocol. You, the nurse, right? Very, very important. You should do that and teach the patient that you can't just flush the thing in the toilet. A nurse is monitoring a client with a heart failure who is receiving bumetanide. Which of the following findings require immediate intervention to the healthcare provider? This is furosemide, the same thing. Replace it if you know it. So if you don't understand that, so that you can see, probably you know furosemide, just replace it. Dizziness when transition from sitting to standing position, headache, leg cramp, and tinnitus. What do you think is the most important you got to call the doctor for? This is a tricky question. They're going to have dizziness. It's okay. We just teach them, right? Slowly together. You're going to have what? Some leg cramps, right? It's bad. But this is a permanent injury. I know someone will say, okay, we have hypokalemia. There's no, I just say leg cramp. If there's no tinnitus there, yeah, it's good. But this one causes permanent damage. This may be early onset of hyponatremia. We got to pick D. It's very, very important. If we don't fix it, we are in problem. But this is the way you have to think about these kind of things. And this is providing teaching to a client prescribe levofloxacin for urinary tract infection. Which dietary choice should the nurse instruct the client to avoid while taking this medication? Select or apply. Taking levofloxacin, what should you avoid? Calcium fortified orange juice, yogurt, milk, gray chicken sandwich, steamed vegetables. What do you think? What do you think? Levofloxacin. These guys, they hate calcium, right? Calcium fortified. Yogurt, right? Milk, too much calcium product in it. They don't like it. Great chicken sandwich and steamed vegetables, fine. But this is medication I want you to know, because these medication avoid dairy product and calcium. It bind to it and it causes so much problem. And also antacids, you should avoid it, and the iron for these particular medications. These antibiotic, levofloxacin, ciprofloxacin, they don't like calcium at all. And this is providing dietary teaching to a client prescribed warfarin. We already talked about it briefly. The dietary choice should be consumed consistently while on this. I change it. Usually I'll tell you they should, you should teach them. But now I said, which of these should they take it consistently in order not to cause complication? The keyword, vitamin K dependent. And therefore, what is your answer? If you on warfarin, you should take these consistently. Brussels sprouts, bunch of vitamin K. Tea, bunch of vitamin K. Broccoli, a bunch of vitamin K. And cranberry juice is fine. So these are all the things that contain high vitamin K products, and you should avoid it. The client is prescribed doxycycline for acne. This is also good medication. You should know antibiotic. No levofloxacin, ciprofloxacin, and doxycycline. Which statement at this chart indicate correct understanding? I will take this medication with milk to prevent upset stomach. We saw it, that they are in the same group as levofloxacin, even though the different antibiotic, the things you shouldn't take is the same. I should use sunscreen when going outside. I can stop taking this medication when my skin clears up. I should take this medication at bedtime. Which one indicate correct understanding? It causes photosensitivity, so you should Use sunscreen when going up. You should have milk, iron, calcium, all those guys. You cannot stop this medication when the skin clears up. You got to finish the antibiotic. You should take this medication at bedtime. There's no specific time. You can take it anytime you want. And this is providing discharge teaching to a client prescribed Residronate, right? We saw the same thing, like Alendronate. They are the same, used for, they are bisphosphonate for osteoporosis. And I give you the clue of what you should do, teaching you should provide, like levothyroxine. Which instruction should the nurse include? Take the medication with the full glass of water. Remain upright for at least 30 minutes after taking the medication. Take the medication with milk to reduce stomach irritation. Take the medication first thing in the morning before eating. Lay down immediately after taking the medication. Take the medication with the sip of water. What do you think? What do you think? Same thing as levothyroxine. Full glass of water. Remain upright. No milk. It's empty stomach. Early in the morning, when you wake up, you should not lay down. You should remain upright. You can't take it with the sip of water. We said take it with the full glass of water. Why do you want to take it with the sip of water? It's a trap. You see how the answers can be trappy? Look at them carefully. Don't fall for them again. And this is teaching a client how to ambulate using crutches with the prescription for non-weight bearing of the left leg. Which of the following should the nurse include? Support body weight on the axilla while using crutches to prevent fall. Place weight on the left leg when stepping forward. The top of the crutches should rest directly against your axilla when standing. Lower the crutches and the left leg when then the left leg when going down the stairs. Basically, how do you use crutches when you're teaching the patient? Basically, the left leg cannot move, is the weak. Therefore, how do you teach them? It's very important. Support your weight on the axilla while using the crutches is wrong. You can't do that. This is wrong. Place the weight on the left leg. They said non-weight bearing. The top of the crutches should rest directly against the axilla. Negative. By default, this is your right answer. Lower the crutches in the left leg first, right? Then the right leg when going down the stairs, right? When you're going down the stairs, the right good leg should stay behind, and the lower leg, which is bad, usually are the one that go first, so that you can support yourself when you fall. And this is caring for older clients who is at risk for fall. Which of the following interventions should the charge nurse question? Bed in the lowest position, room dimly light at night, 2 upper side raised are up, client wearing non-skid footwear. Look at the question well. The client, and this is caring for an older client who is at risk of fall. Which of the following interventions should the charge nurse question? That means the nurse has instituted some intervention. Which one of this the charge nurse should question? The bed is in lowest position. Should she question? The room is dimly light at night, and the 2 upper side rails are up. You remember you have 4 side rails, right? And the client wearing non-skid footwear. Which one? 46. Don't get trapped. The room is too dark in the evening. It's bad. It's going to fall. All other options are appropriate. 2 side rails are up. The upper one are up. The lower one is released. Therefore, this is no restriction. And nurse is caring for a client who is clinically blind. You can see. Which of the following actions should the nurse implement to promote client safety? Selected apply. Blind patient. How do you take care of them? Right? Keep the bed in the lowest position, or rent the client to the environment using clock face description. Rearrange the room layout to improve accessibility. Place the client light within reach. Speak to the client before touching them. A blind patient, how do you care for them? Know these two. Blind patient and somebody who has a hearing problem. How do you care for them? They are very common NCLEX questions on the best care and comfort, right? What do you think? Promote client safety. Safety question. Well, bed in the lowest position is good. Or rank them using clock face. They know 2 o'clock, 1 o'clock. They can imagine it. Rearrange the place to improve accessibility. You think it's a good idea? No, negative. Let the call light within their reach. Speak to the client before touching them. You don't want to change the room layout, right? Otherwise, they get confused. If you already tell them, then you rearrange, it becomes a problem. And this is caring for a client with left-sided heart failure. What do you expect in the left-sided heart failure? Which assessment finding is expected? Pulmonary edema, ascites, crackles in the lungs, jugular vein distension. This is a bonus question. If you mix it, let's get together and tighten our content. Left-sided, what do you expect in this heart failure patient? Put your answer in the comment. I would like to know. Remember, left-sided is a what? What do you think? It's pulmonary congestion, and therefore, I'm looking for lung problem. I see lung problem. The rest, that's no lung issue. Edema, ascites, JVD, or right-sided heart failure. And this is caring for a client receiving IV nitroglyceride. Which finding required the nurse to notify the air care provider? Headache, mean arterial pressure of 50, flushing, dizziness when standing. This is pharmacology, cardiology pharmacology, but it's a trap. We are on English practice question, English review question, English practice test on 85 questions that will make you pass your English. How are you doing so far? Almost at 50 questions. What do you think? What is your score? Put it down in the comment. A, if you have IV nitroglycerin, which one is worrisome? Remember, it causes hypotension, and therefore, which one? Headache expected, flushing expected, dizziness when standing, orthostatic, mean map of 50, bad. You are in shock. Right answer. Boom. And this is reviewing a telestrip for a client. The rhythm show irregular RR interval with no identified P. That means irregular rhythm. There's no P wave. That's all. Which rhythm is irregular and there's no P wave? Don't overthink it. You see bradycardia, AFib, ventricular tachycardia, first degree heart block. Which rhythm has no what? P wave. AFib. Sinus brady, there's a P wave. Ventricular tachycardia, there's no P wave. Yes, but what? It's regular. It's not irregular, right? That's the way you can think about it. This is our strategy to answer question. And this is caring for a client with newly implanted pacemaker, right? Which nursing action are appropriate? Select or apply. If you're taking care of a patient who has a pacemaker, what do? Monitor ECG for electrical capture. Encourage raising the arm above their head. Place the client in bed rest for 7 days. Don't move. Assess the incision site for signs of infection. Apply a magnet directly over the device. Educate the client to avoid strong magnetic field. That's telling you something. You pick your answer. You pick an answer. Which one should you prioritize? You got to monitor capture. That is working. Don't raise your head above your head. Your hands above your head. Why would I lay it down for 7 days? Keep moving. Assess the site for signs of infection. You don't need to demagnetize the device unless they're going to have surgery or something like that. And therefore, educate the client to avoid strong magnetic fields. Is that a clue? What do you think? The thing was just newly implanted. It's not indicated at this time. It's not immediately after teaching, after surgery. It's not going out to go into strong magnetic field. The most important, capture the thing. Don't raise your head. Don't place the client for 7 days. Check for incision. And then don't put anything there. By educating the patient to avoid strong magnetic field, he's not going to go in the hospital. He's not going to see something like that. That's the clue. Which flow rate are correct for the device? The nurse is assessing oxygen flow rate. I'll show you a strategy. Nasal cannula, the maximum you can go is 6. Therefore, this is wrong. Ventral max is precisely 0 to 2 is too small. Nasal cannula is here, 1 to 6. Simple face mask is here. Non-revealed at 10 to 15 liters. So this is good. The client reports sudden onset of right eye pain. Whenever they give you an eye question, if there's a pain, there's two things that can cause that. There's redness, scotomas. Which diagnosis is most likely? Pick one, and I'll show you the strategy. When you see eye question, go with that strategy. Pain, only two things, and then distinguish between them. Cataract, retinal detachment, glaucoma, macular degeneration, acute angle closure glaucoma. Cataract and macular degeneration, no pain. Retinal detachment and acute glaucoma causes pain. But retinal detachment, they'll tell you curtain is falling in their eye and they're losing their vision. Therefore, this is acute glaucoma. That's the strategy you use to answer this kind of eye question problem. And nurse is caring for a client with major burn injuries. Which intervention should the nurse implement during emergent phase? That's resuscitation phase. So which one would you initiate? IV access, give them opiate for pain, ice pack to the burn area, urine output hourly, and nutrition. What do you think? We're trying to save you. Therefore, you need IV. Number one. Pain medication because you are in trouble. Ice pack to the wound is not going to help me. This is the resuscitative phase. And we're going to monitor your urine output. Nutrition is later on. If you know, you see the way I attach the question, yeah, get your content and boom, you use it to answer the question. But otherwise, you'll be guessing. I know this is what is happening. I'm picking answer choice that reflect that stage. Resuscitation is rapid. I don't care about ice pack in your burn or your nutrition. That's not resuscitation. A client with severe malnutrition is receiving hyperalimentation. That means we're feeding you. You have malnutrition like anorexia. Which of the following findings indicate the treatment is effective? If you have malnutrition, then if I feed you, then everything is going to get better. How do I know? Client report increased appetite. Is eating more. His white blood cell is elevated. His pre-albumin level is increased. The client blood glucose is elevated. His energy and activity level is increased or high level. What do you think? Think about it yourself and say, hey, if I'm feeding you and you're getting better, what would I see? That's all. It has nothing to do with your appetite is increased. It doesn't tell me your malnutrition is going away. Just because you're eating, does not help. Your white blood cell has no reflection of your nutrition status. A lot of people will pick it. Trap, don't pick it. Pre-albumin is the way to assess your nutrition level. Your glucose, think about it. Does glucose reflect nutrition level? No, it's bad. When your glucose is high, bad. Your energy level and activity will tell me that. So, trap question, but what? Critical thinking. As usual, adapt NCLEX way. And then prepare to administer prescribed Matos test to a client. I will help you. Skin test for tuberculosis. With statement by the client, make the nurse question the order. That means this patient does not need TB test. I am 8 weeks pregnant. I live in a shelter. I received IM vaccine 1 week ago. I had a 15 millimeter induration in the skin test 2 years ago. Pick your answer. Let me know. This question is my favorite. Put it down in the comment and then describe what you pick, why you pick it. 56 question. Pregnant, you get PPD test. You live in a shelter, of course, we're giving it to you. Influenza, no contraindication. 15 millimeters positive, that means you PPD positive. You only get PPD positive in your lifetime once. Nobody will test you twice if you have one. Write it down. If it's positive, you only get it once in your lifetime. If somebody force you, tell them no. Therefore, that's your right answer. And this is assessing a 4-year-old child. Which developmental milestone is expected? It's 4-year-old in the middle, right? Draw a stick figure with 2 parts, 2 and 4. Do they match? Count to 10. Do you think 4 and 10, how far are they from each other? Use pencil grab, right? Pencil grab, 4-year-old, pencil grab, Work with assistance. I'm trying to lead you to the right answer to think about it. Pacemaker, 9 months, 12 months, you should have achieved that. Working with that system. 4-year-old, why would that happen? Drawing sticky finger with 2 parts, I'm 4. Anything I will do will be greater than 4. Therefore, I count 10. That's the way I do this kind of question, right? 10 counting. And this is assessing a 12-month-old. You can see we're on pediatric. This is the hardest, painful portion of your NCLEX, but this is the strategy how you can answer them. 12-month-old infant, milestone. We're going to use the same strategy. If you're 12-month-old, can you build 6 blocks? Can you walk independently? When do you walk independently? Can you use scissors in your hand? If you can walk independently, can you ride a 3 cycle? If you can't even ride and walk alone, you see, the answer choice should pop up with the candy. You just finally build up your pencil grab 11 month. How can you build 6 block? If you can't build a 6 block, you can't use your scissors. Neither would you ride a tricycle. Therefore, you walk independently. Test taking strategy, adapt NCLEX way. This may be hard. It's pharmacology, but it's okay. It's chemotherapy drugs. I'll help you. Write them down if you don't know. And next, attend the staff education program about chemotherapy agent. The nurse will match with chemotherapy agent and the most likely side effect to indicate correct understanding. These are adapt NCLEX Q-Bank question associated with my on-demand. If you like it, you can subscribe to the on-demand and get access to it and use the question. I get question. Blomycin, cyclophosphamide, vincristine, doxorubicin. Know this medication and the side effect to teach them. Pair them. What do you think? I can tell you, bromycin causes pulmonary fibrosis. It causes lung issue. Cyclophosphamide, if you don't remember, think about it, bladder, orange urine. Vincristine is peripheral neuropathy, or doxorubicin is always cardiac. So I'll bring it here and you can put it. These are the only 4 medications the NCLEX most likely will ask you. So on chemotherapy, so know the side effect. Very, very important. Case study. Are you ready? Client present with fatigue, dyspepsia, shortness of breath, diaphoresis when ambulating and going upstairs. You take omeprazole, it doesn't provide relief. Recent diagnosis of angina, chest pain, and he smoked 2 packs a day. So he has fatigue, dyspepsia, shortness of breath when he's getting sweaty when he's walking and going up the stairs. Something is not right. His alert unrated times 4. Lung is clear bilaterally. No murmur. Abdomen soft. He take multiple medication for his comorbidity, hypertension, hyperlipidemia, and diabetes. Pause the video, read it on your own. And he has elevated ST elevation in anterior leads because he had probably angina before, right? What do you think is wrong with the patient? Once again, fatigue, dyspepsia, shortness of breath, and diaphoresis. When I walk, what is going on with me now? Client undergoes successful catheterization. And this is what. So we're going to go through the case and then we come back to that. The nurse has reviewed the clinical data. Which of the following should the nurse be concerned about? Pink fluid sputum, new onset and S3 mama, crackles at the lung base, 2 pack per day of smoking, oxygen saturation. Based on his symptoms, and he's telling you this, which of these should you worry about? That's all. Pink fluid sputum is pulmonary edema. S3, you have a heart failure. Crackles in the lung base. I don't like it. If you smoke, I can fix it, but your oxygen saturation can be concerning, right? If it's low, I'm worried about it. What is the most likely diagnosis the client is mostly experiencing? Is it pulmonary edema, myocardial infarction, acute decompensated heart failure, and pulmonary embolism? Think about it. If you pick pulmonary edema, it's okay, but what is causing the pulmonary edema? He had a heart failure, no heart attack. A client was diagnosed with acute decompensated heart failure. Which of the following is indicated? If you have a heart failure, IV fluid bolus, daily weight, basic metabolic panel, prescriptions for furosemide, and oxygen therapy. What do you think? Heart failure, what do you give them? What do you give your heart failure patient? IV fluid bolus, you're going to kill them. Measure the daily weight, get a BMP, get a furosemide, and then give them oxygen therapy. The healthcare provider has ordered IV fluid, IV furosemide for the client. Which of the following should the nurse include for safe administration medication? How do you give furosemide? IV. This is a key fundamental question. Assess blood pressure before giving to the patient. Monitor for tendinitis. Monitor serum electrolyte. Administer the IV push rapidly over 1 to 2 minutes. Encourage the client to take the dose at night. What do you think? We're not going to do that at night. He's going to pee on himself. You should not push it. IV push is going to cause hearing problem. Electrolyte, monitor for this, and assess for blood pressure. Now, they say match the major side effect of the appropriate medication. Client was prescribed the following medication. I've been giving digoxin, furosemide, spironolactone, and enalapril. Which are the side effects? Pause the video, answer this. Pharmacology, major side effect. Which one causes hyperkalemia, angioedema, heart block, hypokalemia? What do you think? Furosemide causes hypokalemia. Digoxin causes heart block. Spironolactone, hyperkalemia, and enalapril, angioedema. The client is ready for discharge. Which of the following should the nurse include at discharge? Select or apply. What do you think? Call your PCP if your necklace suddenly does not fit anymore. Check your pulse 1 full minute before taking enalapril. Transition from sitting and standing position slowly. Avoid too much banana. Take antiemetic if you have severe nausea. What this is testing is all the medication we talk about: digoxin, enalapril, furosemide, and spironolactone. Which of these you call? That's all. That's what it's testing. I'll call my PCP if my necklace suddenly does not fit. You should go to the emergency room. That's wrong. Check your pulse 1 full minute when taking enalapril. You don't need to check your pulse if you're taking ACE inhibitor. You should change positions from sitting to standing slowly. You should avoid too much banana. You should not take antiemetic if you have nausea because the digoxin may be causing side effect. So this very important case study, and I hope you learned something out of it. We have 11 questions more. If you're tired, go take a break, drink something, brushing up, and come back and finish this 11 questions. High yield management of care. Some of the questions, as you can see. And this nursing team, it consists of RN, LPN, UAP in caring for a postpartum client 2 days after delivery. Which task can be safely delegated to LPN? LPN, what is that? MMR most. So assess for fundal tone and lochia flow, assist the client with ambulation to the bathroom, teach breastfeeding technique, administer oral pain medication and prescribe. Which of these is okay to give it to LPN? We have LPN, UAP, and RN. If you have all three, everybody should stay in their lane. Assessment will be done by the RN. Assisting the client with ambulating, well, it can be done by LPN and UAP. But there's what? A UAP there. Therefore, what do you think is going to happen? We're going to give it to a UAP. Teach breastfeeding technique, RN. Therefore, by default, oral medication will be given by LPN. And this is caring for a 4 pediatric client. Which client require immediate follow-up? Prioritization 101. Asthma patient, a peak flow is 80. Do you think they are in trouble? Kawasaki patient, you have severe desquamization of the skin. Is this expected or bad problem? A child with tonsillar abscess and trismus. Is this what you expect if you have tonsillar abscess? A child with Bell palsy who is drooling. Is this what you expect if you have drooling? Due to what? Bell palsy. You see the way I'm reading it, I want you to get into the habit and read it so that you don't get trapped, right? Is this normal? Don't pick C. D. If you pick D, it's wrong because Bell palsy, they drool. One side of the mouth is gone, and therefore Saliva will run down. That's an expected finding. Tonsillar abscess, and you have 2 months, that means you cannot open your mouth, airway problem. Kawasaki, your skin is going to peel, expected finding. Peak flow for asthma 80, you are in green zone. We're picking C, don't pick D. And next is caring for several pediatric clients who should be seen first. Same strategy. Tetralogy of Fallot, and I have clapping of my feet. Is that what I should see? Ventricular septal defect with grunting. Is that what I should see? Kawasaki, same thing. Severe discrimination of the skin and coarctation of the aorta with lower extremities pulses and the upper extremities. There's difference. What do you think? Don't pick no lower extremity pulses and upper extremity pulses. Look, it's a trap. Coarctation is expected finding. Kawasaki discrimination, expected finding. Ventricular septal defect, if you're granting, bad. Tetralogy of Fallot, true expect clapping, expected finding. And this is caring for a pediatric client with holosystolic mama who became cyanotic during crying, feeding, agitation. What do you think? Tetralogy of Fallot. Which action should the nurse take during this episode? Tetralogy of Fallot, having tit spell, what do you do? Notify the healthcare provider immediately, administer prescribed morphine, give them oxygen, comfort the client. Strategy to answer the question. If you get this right, let me know. Put in the answer choice, and I will give you thumbs up. What do you think? Question 64. What do you do if patient who have tetralogy of Fallot and he having tit spell? Calm the kid down. If you calm down, everything will be done. All this can be done later on. Not a big problem. And next is review assessment finding for multiple client with cardiac condition. Which finding are most concerning? Selected apply. A client with aortic stenosis, harsh murmur at the right upper border. Is that what you expect? A client with aortic stenosis with the chest pain. A client with aortic aneurysm with this blood pressure. A client with CAD prescribed sumatriptan. A client with coarctation reporting leg pain with activity. Which condition is most concerning? This is cardiology, expected finding, no discontent. If you need help, check adapting class. If you have aortic stenosis, harsh murmur at the left, right upper sternum border, that's what I should expect. I'm moving on. Aortic stenosis with chest pain, bad. You're going to have syncope and die. Aneurysm with this blood pressure, that's what we should expect. What do you think? Yes. Too much blood pressure, you're going to bleed. Hypertension, you're going to have trouble. Coronary disease, you should avoid sumatriptan, which is what? Migraine medication. It causes vasoconstriction. Coarctation, less blood flow to your leg than the upper extremities, you're going to have leg pain. Expected finding. Hard one, cardiology. And this is providing teaching instruction for a client with PAD. Which statement by the client indicate need for further teaching? I told you, PAD, less blood flow. Therefore, what? You need to increase blood flow to your leg. I will avoid elevating my leg while resting. I will start walking daily to improve circulation. I should use a heating pad to keep my feet warm. I need to inspect my feet daily for any wound or sore. 66, pick your answer, put it in the comment, pause the video. No blood flow. If you put a heating pad in your leg is dead. Rest or expected finding. Elevate your leg is bad, therefore keep it down. Walking, improve blood flow. Inspect for any injury to your leg. Short, straightforward content I want you to take and then use it to answer questions when you see it. Client rates their pain 9 out of 10, best care and comfort, which is the next priority. I have pain 9 out of 10. Do you give me pain medication or you figure out what is wrong? Administer prescribed analgesic immediately. Assess quality, location, duration of the pain. Notify the healthcare provider and encourage deep breathing. Well, assess the patient. A new graduate received the following prescription. Administer 1 amp of calcium gluconate. Which action by the names indicate correct understanding how to prepare medication from an amp? You have to know how to do that. Snap the amp away from you. So this is what it looks. If you don't know what it is, it comes in the long bottle straight like that. And at the tip is this. And then you got to take care of this before you can withdraw the medication. So it says snap the amp away from the body using alcohol. So pull it away with the gauze. Draw up the medication using a regular syringe. So put in a regular syringe and draw it without a filter needle. Inject air into the amp before withdrawing, or shake the amp and mix it with medication before drawing up. If you don't know, these are fundamentals. I want you to take a note. I have a fundamental review in my channel. You can watch. It will teach you how to do safe medication administration. Which one? You should not shake the thing. 68. Don't shake it. Don't inject air into the amp before withdrawing. Draw out. You shouldn't use a regular needle. You should have a filter needle, and you should put the glass away so that it doesn't break you. And that's the way to do it. So use a filter needle. You should not inject air, and you should not shake it. And you pull the amp, draw the thing away from you, the glass, as you break it, so that it provides some safety. 3 more questions. And this is conducting a swallowing assessment for a client after a neurological event. Which of the following is most consistent with dysphagia? No signs of aspiration or coughing, repeated attempt to swallow and frequent throat clearing, clear voice quality after meal, smooth coordinated chewing. Which one tell me this patient is having dysphagia? No signs of aspiration or coughing is good. But if clearing his throat multiple times, hey, we have a problem. His voice is good, there's nothing wrong. Smooth coordinated chewing is also fine. Therefore, this is your right answer. Question 70. A nurse is teaching a client with what? A new ileostomy. Which of the following should the nurse instruct client to avoid? Anything that can clog it, too much fiber, too much on pill, empty the pouch regularly, fine. Drink adequate fluid, good. Eating a balanced diet, good. High fiber diet, bad problem. And the last question. Thank you for reaching 71. Thank you for watching. And if this video helped you, subscribe for more. And nurse is caring for a client on the 4 precaution, which action is appropriate. Turn off the bed alarm during hourly round. Keep the core lights within reach at all times. Allow the client to walk to the bathroom alone. Place the bed in the highest Fallot position. Pick your answer. 71. Because of the case study, all of them had up to 85 questions. And I hope you get over 65. Thank you for watching, and good luck in your exams. B is the right answer. Take care and good luck.